Hi everyone, welcome back to the vlog. Last episode we talked about how to approach a tough or unknown diagnosis and how to navigate that as a new therapist. Today I want to talk about a topic that can seem just as intimidating as a new graduate, and that is splinting. Splinting is one of those skills that can feel very specialized. You watch therapists who have been doing this for years and they make splints look effortless. They have clean edges, beautiful angles, and a perfect fit every time. You attend a splint lab or a continuing education course, and it seems like they can fabricate the splint within minutes and they make it look so easy. But what we often forget is that these clinicians have had years and years of practice in splinting. As a clinician who's not even 1 year into my own practice, I can confidently say that splinting is not a skill that you master overnight. It's practice, it's repetition, it's trial and error. There are so many different types: static, dynamic, static progressive, relative motion, and each requires its own different biomechanical considerations. Some diagnoses require very specific joint angles, especially in postoperative protocols where the joint angles matter for tissue protection and healing. That responsibility alone can feel very overwhelming when you're early in your career. And on top of that, you're not working on perfect hands that you practice with in school. You're working with real patients who have edema, open wounds, contractures, pain, and anxiety around their diagnosis. Even though splinting is something that we may learn early on in our careers or even in school, it is not an entry-level skill. So I want to share an example from my own practice. I recently had a patient come in to schedule post-cast removal for a metacarpal base fracture of digits 3 and 4. And knowing that they had to be out of a splint after their cast removal, I wanted to make sure this one was on my schedule because it is one that I have not practiced very often. In those 2 weeks I had until his cast removal, I made sure to practice the splint with my colleagues, talking through the joint angles and the postoperative protocols, and making sure I fabricated it at least 3 to 4 times before seeing the patient. Because of that preparation, I felt much more confident when it came to actually fabricating the splint. When you take time to understand the purpose of the splint and the biomechanics behind it, it becomes less about guessing and more about applying knowledge when seeing the patient. And even when I felt prepared, it still required increased time to check the fit, modify it, make sure that it was comfortable for the patient, and make sure that my joint angles were correct. I had to remind myself to slow down, assess comfort, and make changes intentionally instead of just trying to rush through it because I was anxious. Being prepared helped, but allowing myself to work through the process and learn through it helped even more. So if splinting makes you nervous, it does not mean that you are not cut out to be a hand therapist. It is okay if your splints take longer at first. It's okay if you need to reheat and readjust the splint multiple times, and it is okay to ask a senior therapist for help when you are splinting. All of this is a part of the process and your overall growth as a hand therapist. So I want to ask you guys, tell me about the first time that you made a splint for a patient, or if you're a student or a new graduate, tell me about a splint that might feel a little intimidating for you to do right now. That way we can see that we're not alone and we can normalize this learning curve together. In the next episode, we're going to talk about communication strategies for a new clinician and how to confidently speak with physicians, senior therapists, and clinic administrators. As always, if you guys have any ideas or recommendations for future videos, please leave them in the comments below. Thanks for watching, and I'll see you in the next episode.